Influenza Illness and Immunization Learning Module, 2017, Part 1. The 2017-2018 influenza season will be introducing a universal program for PEI. This means that there's no cost to administration or the vaccine. Individuals living in PEI with a health card will receive the vaccine free of charge. And all individuals living, working, or attending school in PEI will receive the vaccine free of charge. I'll go into a little bit more detail in later slides. The objective of this module is to review influenza disease, review influenza vaccines, and promote immunization to prevent influenza illness. Influenza is a respiratory infection. It is caused primarily by Influenza A and B viruses. And activity is low in the spring and summer months and peaks in the fall and winter in the northern hemisphere. We generally see our first influenza case as early as October, and it has been, our influenza season has started as late as February in previous years. Symptoms of influenza in primary illness include sudden onset of high fever, muscle aches, cough, chills, and throat irritation. Other symptoms may include headache, fatigue, loss of appetite, watery eyes, runny nose, and sneezing. Complications of influenza illness or secondary illness include ear infection, viral pneumonia, secondary bacterial pneumonia, worsening of underlying conditions, and death. Influenza illness compounds complications of disease and illness in individuals with underlying medical conditions such as asthma, chronic obstructive pulmonary disease, COPD, and diabetes, just to name a few. How common is influenza illness? Approximately 10 to 20% of the population are infected annually. The highest rates are in children aged 5 to 9 years, and approximately 20 to 30% of all children are infected annually. Rates of serious illness and death are highest among those 65 years of age and older, those who have chronic illness, and children under the age of 2. Most will recover from influenza illness within a week to 10 days, but some, those who are greater than 65 years and older, adults and children with chronic illness, are at greater risk of more serious complications or worsening of underlying medical conditions. There are over 12,200 hospitalizations reported in Canada each year. 3,500 deaths are due to pneumonia related to influenza, and approximately 1.5 million workdays are lost. Influenza and pneumonia is ranked among the top 10 leading causes of death in Canada. The 2016-2017 influenza season summary. There were 208 lab-confirmed cases of influenza. 95% of those were influenza A, 5% were B. There were 88 reported hospitalizations that were attributable to influenza illness, and those were lab-confirmed cases of influenza. 11 of those patients were in ICU, and there were 5 deaths that were attributable to influenza illness. The average length of stay for those 88 hospitalizations was 13 days. There were 17 reported outbreaks in long-term care. 13 of those were influenza A. There were none for B, and 4 for influenza-like illness. And this is because residents were tested, but there was no confirmed cases of influenza A or B reported. Outbreaks are notifiable under the Public Health Act to the Chief Public Health Office. There are 2 types of influenza viruses that we worry about as humans. Influenza A, which is most common and more widespread, and Influenza B tends to be more localized. Influenza B may cause a less severe reaction than Influenza A, and Influenza B does not cause pandemics. Influenza A viruses are divided into subtypes based on two proteins on the surface of the virus, the hemagglutinin H and the neuraminidase N. The hemagglutinin enter and destroy the cell, and there are 18 different subtypes, H1 through H18. And neuraminidase exit and spread among other cells, and there are 11 different subtypes, N1 through N11. Influenza A viruses can be broken down further into different strains. Current subtypes of Influenza A viruses found in people are H1N1 and H3N2 viruses. In 2009, a new Influenza A H1N1 virus emerged to cause illness. This virus was very different from the human Influenza A H1N1 viruses circulating at that time. The new virus caused the first influenza pandemic in more than 40 years. A pandemic is generally caused when there are two or more different viruses combined to form a new subtype, and this is called an antigenic shift in the virus. An antigenic drift is when there are small changes in the genes of the influenza virus. This year's vaccine for 2017-2018, the strains included in the vaccine are A Michigan, H1N1, and A Hong Kong, H3N2. Influenza B viruses are not divided into subtypes, but can be further broken down into lineages and strains. Currently circulating influenza viruses belong to two lineages, B Yamagata and B Victoria. Influenza B is typically less severe than Influenza A, but depending on the strain and the underlying medical conditions, can cause severe illness. The 2017-2018 strains of B included in the vaccine are B Brisbane, which is a B Victoria lineage, and B Phuket, which is a B Yamagata lineage. So what does the vaccine do? It provides immunity to the hemagglutinin and the neuraminidase proteins. It helps to reduce the likelihood of infection, and it lessens the severity of disease if infection does occur following immunization. Antibody response to the vaccine depends on several factors, such as the age of the recipient. Very old may not mount a robust response to the vaccine. Whether there was any prior exposures to the antigens in the vaccine, increased exposures, increased response, and the presence of immunocompromising conditions can decrease the response. And those are individuals on immunosuppressive therapy, long-term steroids, monoclonal antibodies, transplant patients, individuals receiving chemotherapy, and individuals who have been diagnosed with HIV or AIDS. Antibody protection from influenza vaccination usually occurs within 2 weeks after administration. Influenza is spread by droplet, coughing and sneezing, or direct contact with secretions. The droplets, when people are coughing and sneezing, fly in the air approximately 2 meters, 6 feet, and they'll drop to a surface. If there's somebody within that 6-foot radius or 2-meter radius, then they may become infected. The virus enters the nose and the throat, and it replicates. It infects the cells of the upper respiratory system, causing swelling and inflammation. It then proceeds to the trachea and lungs, the virus enters the bloodstream, and this is where symptoms first begin to appear. The incubation period of the virus is usually 2 days, but can range from 1 to 4 days. Adults have the ability to spread the virus 1 day before symptoms appear and up to 5 days after. Children and those with weakened immune systems are infectious for longer, and children often have mild symptoms but are highly contagious, and this is likely due to poor cough etiquette and contaminating their environment. Influenza illness can be prevented by getting your annual influenza immunization, performing hand hygiene, especially when ill, respiratory etiquette covering cough and sneezing or coughing into your elbow and sleeve, and performing hand hygiene after, and staying home when ill. Influenza vaccine is safe and well tolerated, and remember, immunity to the hemagglutinin and neuraminidase surface proteins from the vaccine will help to decrease infection or decrease the severity of infection. Currently, there are many approved vaccines available in Canada and on the market. Some products are developed for specific populations, such as the LAIV attenuated influenza vaccine, or Flumist, which is available for ages 2 to 59 years. In PEI, it is only available for ages 2 and up to 17 years of age. A quadrivalent vaccine is recommended for children 6 months to 17 years of age, and this is because it has 2 strains of B in it, and both B strains are recommended for children due to the burden of disease in this age group. And the adjuvanted trivalent influenza vaccine is only available for age 65 years of age and older. As I mentioned earlier, PEI will have a universal program starting this year. The vaccine is provided to all individuals living in PEI at no cost. It is available at public health nursing clinics, physicians' offices, and pharmacies. Individuals who live in PEI and do not possess a PEI health card will be instructed to go to public health nursing clinic to receive their free vaccine. And individuals visiting PEI can go to a pharmacy and will probably be required to pay an administration fee. PEI has purchased 3 vaccines: Fluzone, which is a quadrivalent vaccine; Fluad is a trivalent with an adjuvant; and Flumist. The quadrivalent has 2 A strains and 2 B strains in the vaccine. Fluzone and Flumist are quadrivalent vaccines. The trivalent vaccine has 2 A strains and 1 B. The B is Brisbane. I've linked all the product monographs in this presentation. Please ensure that you check the product monograph that is in the product insert when you receive the vaccine to ensure that it is most up-to-date and current. I will go through each one of the products that we've purchased for PEI this year that will be available in the clinics and in long-term care. Fluzone, a QIV product. It is a quadrivalent vaccine, 2 A's and 2 B's. It is an inactivated vaccine. All persons aged 6 months and older can receive the vaccine in PEI. It is available in a pre-filled syringe single dose. Adults and children dose is 0.5 mils. If children are under the age of 9 years and it is their first time receiving influenza vaccine, they will require 2 doses, 1 month apart. I will review the contraindications for all the vaccines in a later part of the presentation. Fluad is an adjuvanted trivalent influenza vaccine. It's an inactivated vaccine as well. It's available for residents of long-term care and community care facilities in PEI age 65 and older, those awaiting placement for long-term care but who are in acute care. There are 2,200 doses ordered for PEI, and it's also available in a pre-filled syringe. This product is more immunogenic for the elderly. The Fluad product contains an adjuvant, and this means that it causes a local immune stimulatory effect at the injection site. It increases the influx of macrophages and monocytes and attracts more innate immune cells. It increases transport of antigen to the lymph nodes, and it causes an improved T-cell priming to develop immunity. And it's for the elderly population. Flumist is a quadrivalent vaccine. It is a LAIV vaccine. It's approved for ages 2 to 59 years, but as I mentioned before, it is only available in PEI for ages 2 years up to 17 years. It is an intranasal vaccine administered in divided doses, half in each nostril. There is a syringe lock mechanism that divides the doses. Those who are less than 9 years of age receiving the vaccine for the first time will require 2 doses, 1 month apart. Contraindications and precautions for Flumist. I will go into those in more detail later in the presentation. As a precautionary measure, recipients should avoid close association with persons with severe immunocompromising conditions such as bone marrow transplant for at least 2 weeks following vaccination, and this is due to a theoretical risk of transmitting a vaccine virus. Ensure that you review the product monograph and the NACI statement. An egg allergy is no longer a contraindication, and there was a special release of a NACI statement in 2016-2017 responding to this. Common side effects of those receiving this vaccine are runny, stuffy nose, sore throat, and fever. Because Flumist is a live vaccine, it is not for those who work with immunocompromised or those who are caring for patients in hospital or others requiring care. Also, household contacts of immunocompromised individuals, such as children, parents, or siblings of those who are receiving chemotherapy, have had a bone marrow transplant in the past. Flumist provides an immune response which involves both the mucosal upper respiratory tract and systemic immunity, which is a local stimulatory effect. The influenza strains in the live attenuated vaccine are cold adapted and temperature sensitive to replicate in the nasal area, and the strain is attenuated so that it does not cause illness. Although this year is a universal program, priority groups are encouraged to get the vaccine. Priority groups include children 6 to 59 months of age, those greater than 65 years, and residents of long-term care. Adults and children with chronic health conditions such as cardiac illness, diabetes, asthma. Immunocompromised, those who are on long-term steroids, on medications that decrease immunity, such as chemotherapy. Pregnant women, children receiving aspirin or salicylate therapy, indigenous peoples, or those who are morbidly obese. Other priority groups are those who are capable of transmitting influenza, and those would include household contacts of high-risk individuals, those who are living with individuals who cannot receive the vaccine, immunocompromised receiving chemotherapy, household contacts of infants who are less than 6 months of age who cannot receive the vaccine. If there are people who are providing regular child care to children under the age of 59 months, such as daycares, and also healthcare providers. Influenza vaccine immunization benefits both the healthcare provider and the patient. It protects the patient. Transmission of influenza illness may result in significant morbidity and mortality. The patients are quite vulnerable, and often their response to immunization is not as robust as somebody who is well and healthy. And also, by healthcare providers receiving vaccine, it reduces the illness in the community. It is the responsibility of healthcare workers to be immunized. It's an essential component of standard of care. And by being immunized and protecting themselves, this may lead to less time lost from work due to illness from influenza. Other priority groups who have been identified are essential community service workers such as police, volunteers, firefighters, and poultry workers. I'll now go into the second part of the module for influenza illness and immunization, Part 2. The objectives of the module will be to review protocols for administration of vaccines, enable nurses to respond to common questions about influenza illness and immunization, and identify reliable resources for health professionals and the public to review. Protocols for administration of influenza vaccine. Protocols when administering vaccine relate to vaccine storage and handling, readiness for emergency, which includes anaphylaxis, routine practices such as hand hygiene and safety, review of the product monograph, and the National Advisory Committee on Immunization NACI statement for 2017-2018 influenza, contraindications of vaccines, informed consent and fact sheet, patient assessment and checklist, administration of vaccine site and route, observation after immunization, reporting of adverse events and follow-up, and vaccine documentation and reporting. And I'll go through each one of these individually. Number 1, vaccine storage and handling. Store the vaccine between 2 and 8 degrees Celsius. It is considered a biological product. Place the vaccine in the middle of the refrigerator, not on the door. By having it on the door, this exposes the vaccine to repeated temperature fluctuations. Never use a bar fridge. It's too difficult to maintain a consistent temperature, especially those bar fridges with a freezer component. Monitor the fridge temperature. You can either use a graph, digital, minimum maximum thermometer, or an alarm system. Record the temperature twice a day while there is vaccine in it. Report any break in the cold chain to the Chief Public Health Office. A form is available from the CPHO that can be faxed in. Do not use the vaccine until you hear back from the Chief Public Health Office. We will investigate and provide direction following a cold chain break. And remember, repeated exposure to heat or light are cumulative with vaccines. Never use a vaccine that has been frozen. Transport in an insulated bag with a freezer pack and a thermometer. Ensure that the vaccine is not touching the freezer pack, that it's protected with either bubble wrap or newspaper. On clinic day, you may use towels or linens to protect the vaccine against a freezer pack if you're keeping them together. And try not to leave the vaccine out of the fridge or an insulated bag on clinic day for any length of time. Contact the Chief Public Health Office if the vaccine is frozen or if there's a fridge malfunction. Fainting, breath holding, and anxiety are not considered emergencies or life-threatening responses to the vaccine. Anaphylaxis is an emergency. The risk is rare, 0.4 to 1.8 cases per million doses given. It is life-threatening but manageable. Ensure that you have proper protocols and policies in place when you're administering vaccine in your clinics. Ensure that you have an epinephrine kit available, and chart symptoms and response, and submit an AFI form. Anaphylaxis includes reactions such as skin rashes, itching, and hives, swelling of the lips, tongue, or throat, shortness of breath, trouble breathing, wheezing. There's a whistling sound during breathing. Dizziness or fainting can also be a sign of anaphylaxis. A drop in blood pressure can cause this. Stomach pain, vomiting, or diarrhea, and feeling like something awful is about to happen are all signs of anaphylaxis. Number 3, routine practices. This includes hand hygiene. Perform hand hygiene before and after giving vaccine, between patients, whenever your hands are visibly soiled. And you can use an alcohol-based hand sanitizer with a 70% alcohol content during clinic days. Ensure that you have a biohazard container to dispose of your sharps. Prior to administration of the vaccine, the product monograph for each of the products that you'll be immunizing for should be reviewed. The NACI statement for the 2017-2018 influenza should be reviewed. All of the product this year is available in a single dose syringe. Ensure that you check the expiry date and do a visual inspection of the product, looking at the color, whether there's any particles in the vaccine syringe. Contraindications of any vaccine include a true anaphylactic reaction to a previous dose or any vaccine component, previous Guillain-Barré syndrome that has been medically diagnosed within 6 weeks of any immunization. And GBS is characterized by the rapid onset of numbness, weakness, and paralysis of the legs, arms, respiratory muscles, and face. And it is ascending, meaning that it travels from the limbs to the torso. Another contraindication are people who have experienced an oculo-respiratory syndrome with lower respiratory symptoms, and these individuals should have an expert review prior to administration of vaccine. Those who are experiencing current febrile illness should be asked to return later. And in the last contraindication are those individuals less than 6 months of age. Contraindications of the LAIV attenuated influenza vaccine. Children under the age of 24 months should not receive this vaccine. Individuals with severe asthma who are on oral or high-dose inhaled glucocorticosteroids, or those who have had active wheezing or have seen a physician for wheezing in the past 7 days. Children 2 to 17 years of age receiving aspirin or aspirin-containing therapy should not receive this vaccine. And it is recommended that aspirin-containing products in children less than 18 years of age be delayed for at least 4 weeks after receipt of this vaccine. Pregnant women, and that is because there is no data or research on administration of this vaccine to this population. And persons with immunocompromising conditions, such as those individuals undergoing chemotherapy, radiation treatment, or those taking medications that weaken or suppress the immune system. Number 6, informed consent. Individuals presenting for influenza vaccine must give consent either verbally or written. It must be voluntary, and they must have the capacity to give consent. They must be provided with written information if they ask in understandable language. And they must be aware of what product they're receiving, the benefits and the risks of having influenza vaccine, the common side effects of following influenza vaccine administration, and they must also be provided with information about the risks if they do not receive the vaccine. Number 7, patient assessment. Assess the patient's health for that day that they're coming for their vaccine. Are they feeling well? Do they have an underlying illness? Do they have a febrile illness? If they have a febrile illness, they should be asked to return for their vaccine at another day. Have they had a previous reaction to this vaccine or any components of another vaccine? And what was their reaction? And have they been diagnosed with Guillain-Barré syndrome within 6 weeks of immunization in the past? A patient assessment should be done and to assess for health conditions for a live attenuated influenza vaccine. Those who should not receive the vaccine are children under the age of 24 months, pregnant women due to a lack of safety data, those who are immunocompromised, who are on medications that would decrease their immune response, severe asthmatics, or those who have had wheezing in the past week or 7 days. Number 9, administration of vaccine. The Fluzone and Fluad products, QIV and TIV, are administered as an intramuscular injection. For infants under the age of 1 year, the vastus lateralis site is used, located on the anterior lateral aspect of the thigh, a handbreadth above the knee to a handbreadth below the greater trochanter of the femur. From the midline of the thigh to the midline of the thigh's outer side, inject into the middle third of the muscle. For adults and children over the age of 1 year, the deltoid muscle is used. 3 to 4 finger widths below the acromion process. Imagine an upside down triangle and administer in the middle of that triangle at a 90-degree angle. Ensure that landmarking is not too high. If administering to a child or an infant, ensure that the child is positioned comfortably and safely. The QIV and adjuvanted TIV product, Fluzone and Fluad, are available in a pre-filled syringe, single dose. A needle needs to be added. For IM injection, a 7/8 inch needle is used for infants and small children, 25 gauge, and for adults or all others, 1 inch to 1.5 inch, depending on the size of the arm. The larger the arm, the longer the needle. For any vaccine, observe for 15 to 30 minutes after the vaccine is administered. Flumist is an intranasal vaccine. It is available in a syringe, and the syringe has a syringe lock mechanism with divided doses, half dose in each nostril. It is administered in PEI to those 2 years to 17 years of age, and you can receive it at public health nursing, physicians' offices, or pediatric clinics. It's not available anywhere else. And observe for 15 to 30 minutes after vaccine has been administered. Common side effects following administration of the vaccine are local soreness at the site for up to 2 days, fever, malaise within 6 to 12 hours, and it sometimes lasts 1 to 2 days. Comfort measures include an anti-inflammatory, an antipyretic, and no SA in children. Number 11, serious adverse events. Anaphylaxis and ocularespiratory syndrome and Guillain-Barré syndrome within 6 weeks of receiving vaccine are all considered serious adverse events and must be reported. Anaphylaxis, as mentioned earlier, develops following an immunization with symptoms such as skin rashes, itching and hives, swelling of the lips, tongue, or throat, shortness of breath, trouble breathing, dizziness or fainting, stomach pain, vomiting or diarrhea, or feeling like something awful is about to happen. Oculo-respiratory syndrome is the presence of bilateral red eyes plus one or more respiratory symptoms. And as mentioned earlier, GBS is a neurological syndrome with symptoms of paralysis, characterized by the rapid onset of numbness and weakness, and often paralysis of the legs, arms, respiratory muscles, and face. Paralysis is ascending, meaning that it travels up from the limbs, from the fingers and toes towards the torso. The risk of Guillain-Barré syndrome is estimated at 1 per 1 million immunizations. This means that the risk is 1 immunization per 1 million. If you develop influenza illness, the risk of GBS is 17 cases per million. Report adverse events using the A-TIV form, the adverse event following immunization form. The link is in this slide to the Public Health Agency of Canada, which has the form, which is fillable. Submit the form to the Chief Public Health Office. This form should be submitted within 24 hours after becoming aware of the event, which is when the adverse event has been reported to the healthcare provider, and this may be days or hours following the immunization. The Chief Public Health Office will investigate and reply to the reporter. Follow-up will happen with the patient. VAC oversees reporting, and it's part of their post-marketing safety surveillance to ensure that all of our vaccines that we are administering are safe. And we'll determine whether, or try to determine whether the incident, the adverse event, was either coincidental or causal. And coincidental was the event attributable to an illness or something other than the vaccine, or was the event causal? Was the vaccine the cause of the adverse event? Number 12, vaccine documentation. What do you document after you administer a vaccine? You document the vaccine name, the lot number, and the manufacturer, the date that the vaccine was administered, the site, the dose, and the route of administration. Immunizers must sign and use their designation, and documentation of an adverse event if it occurs. Where is documentation done? Organizational records, charts or registries, and a person's record, the date the vaccine was given. Number 12, reporting requirements. All vaccines administered must be reported to the Chief Public Health Office. Reporting is a requirement under the Public Health Act and the immunization regulations. Reporting can be done either electronically or paper, depending on where your vaccine is being administered. Whether you have electronic access, paper can be submitted. Instructions of reporting requirements will be sent to all workplaces prior to the influenza campaign being started in October. And also, any episode of an adverse event must be reported to the Chief Public Health Office. I'll now go into some myths and answer any questions regarding those myths. So how would you respond to myth number 1? The vaccine gave me influenza. The vaccine is not a live virus. It is an inactivated virus. It cannot cause influenza. One may be incubating an illness at the time of immunization, so it may be coincidental. And compare the symptoms of a cold versus influenza. It takes approximately 2 weeks after receiving the vaccine to mount a response. How would you respond to myth number 2? I don't need another flu shot. I got it last year. Each year there's different strains of influenza that circulate. The vaccine is based on those strains that we hope are circulating each year. And immunity wanes over a few months. So the vaccine that you got last year won't cover you for this year. Myth number 3, I didn't get influenza vaccine last year and I didn't get sick. Well, last year is certainly not a predictor of what may happen this year. Each year, the seasonal population epidemiology differs. It can affect different parts of the population from one year to the next. The elderly one year, the very young the next. Myth number 4, I'm young and healthy and don't need it. Even healthy people can become ill with influenza vaccine. Healthy people can also spread influenza, and by getting the vaccine, it reduces the chances of infecting someone more vulnerable. Myth number 5, influenza is just a bad cold. Influenza is caused by a different virus than the virus that causes a cold. Influenza symptoms are much worse than a cold, and complications are much more serious and more severe. The next 2 slides, this slide is the resources for health professionals, and there's links to all of these slides. Please ensure that you review the product monograph for the vaccine that you'll be administering in your clinics. And these are some resources for parents or public if they're looking for some resources on influenza or vaccines. Thank you. If you have any questions, please feel free to call the Chief Public Health Office for any information on influenza vaccine.